everyone, my name's Amanda Blevins.
And I'm Nefta Erroa.
And we celebrated our first ever virtual Congreso and wanted to give you a highlight of what happened during the event.
Our Congreso is an event for us to hear questions from our members regarding our services, as well as the feedback on how to improve them.
So during the event, we invited a group of members to attend via Zoom, and we encouraged them to ask us questions and provide feedback. We were also live on our Facebook page, and we had a group asking questions there as well.
During this event, we covered three main topics, or main sections. The first one was accessibility of services during the pandemic. Then the second one was how was my visit at LCH during this pandemic. And the third one, community resources that you are aware of during this pandemic as well.
So we had this conversation together with a group of panelists that included LCH's CEO, Dr. Mariana Israelson, our medical director, Dr. Federico Seppa, our lead social assistance caseworker, Betsy Quijano, and our lead behavioral health consultant, Abner Santiago.
We started with Dr. Israelson talking about what we have been doing at LCH during this pandemic. We have had to adapt to everything because what's happening around us. We have had to provide services to people with COVID-19 symptoms. We have a center located outside the LCH Cannon Square location, and we are testing people with symptoms in that location. We are performing tests, and we get the results at 48 hours to 3 days. After the results are here, we let them know, and then we guide them on what to do. We have also adapted to the limitations of staff coming into the office, which affected how many members we could see at the office. However, we have implemented telehealth, and this way we can still provide the services that we are used to via video using the smartphone. We have also adapted to provide education in our webpage regarding COVID-19 updates and LCH services, what to do, and more.
And then finally, she mentioned that we recently received funding to be able to bring testing to local mushroom farms. So we provide a full medical evaluation and then test them, and then communicate those results back to those who were tested. And finally, we also managed to open our brand new pediatric center in West Grove to provide services to children.
After Dr. Israelson's introduction, we transitioned to our first topic, or first section, accessibility of services during the pandemic. And the participants were encouraged to ask their questions. One of the first questions was, what services are available at LCH at this time?
So Dr. Seppa took this question, and he said that at that time we were still seeing acute visits. So if you have any symptoms of COVID-19, we can see you at our Kennett location outside, and we're also seeing patients over telehealth. So on Monday, June 8th, we started to see more patients in the office offering chronic care. But if possible, we're still seeing those appointments through telehealth. Dr. Israelson also let us know that our Oxford site is open and our pediatric center is open to children as well. Chronic care appointments can now be seen in person, but through telehealth as well.
Yeah, we were also asked if we will provide tests outside mushroom farms, and Dr. Israelson answered that we do not plan to do that because of the type of grant and funding that we have gotten for these tests that we're performing at the mushroom farms. We work together with the health department, and while LCH is going to the mushroom farms, the health department is having places where they can be testing the community as well. During the conversation of testing, we were asked if we provide antibody testing. Dr. Seppa answered that we are not currently doing those at LCH. There are only specific places who do them, but we won't do them. He also explained that the difference between the antibody testing and the COVID-19 testing is that the COVID-19 test is to check if you are currently having the virus or are sick. And then the antibody is related to if you may or may not have had or have it. That other one is about exposure only. So just, the Antibody testing is only to find out if you've been exposed. And if you're having any symptoms, please call LCH so that we can help you.
So then before moving to the next section, there was a question regarding safety and what it's like coming to LCH. And Dr. Israelson answered that LCH has brought a cleaning crew in twice per day. Everyone wears a mask while they're inside of LCH. And everyone's checked for fever, so they do a temperature check before coming into the building. We have plastic barriers between employees and members, so everyone's protected and safe within the office. So moving on to the next topic, we talked about your appointment at LCH, and one of the questions was regarding how telehealth works. So Dr. Seppa answered by explaining in a series of steps. So the first step is making sure that you have a phone that has video capabilities. And if you do, then someone will give you a call before your appointment and just give you a little bit of information, get some information from you. And then what we'll do is we'll send you a text to that device. You can tap the link that's in that text that'll open it, and then you'll get a message that will ask if you're willing to grant video and microphone access. And once you do that, you'll see a medical assistant on the other line, and they'll start the visit with you.
One of our members provided some feedback regarding the appointment schedule at LCH and how she struggled to get her appointment. Dr. Israelson mentioned that we have had an increase in phone calls volumes in the last couple of months due to this pandemic, and that we're also had to move some people from a specific department to a different one to help fulfill the needs, because we have had a reduced personnel during this time as well, because of people working from home. And so during this time, we are requiring more staff efforts, and we have had to reassign people. But we promise to do our best to improve this situation.
And then we received a question asking about if you go to a medical appointment, can you be tested for COVID as well? So Dr. Seppa let us know that if you aren't here for a COVID-19 visit, that we don't do them in the same visit. And the reason is because anyone with any upper respiratory issues or symptoms of COVID-19 are seen outside of the trailer next to our building, just to help minimize exposure between the two groups. So Dr. Israelson did say that if you're feeling symptoms, please call to get an appointment for a quick telehealth visit, and the provider can determine if you need to be seen for a test.
Perfect. And then we have another question, and this one was regarding the BHC team and how it has been, if someone has been feeling stressed, how we can see a counselor during my visit. That was the actual question. And Abner Santiago replied that you can talk to any counselor at any point. You can also reach out to the counselor with telehealth at any point. There is no barrier to reach out a counselor when you need it.
Yeah. So, and then after that, we moved into the third section, which was regarding our community services. And we were asked a question regarding unemployment because of being furloughed. So Betsy Quijano let us know that you can apply for unemployment over the phone or online, and our caseworkers at LCH can help you. So all you need to do is give a call to 610-444-7550 and then select extension or option 7, and you can leave a voicemail with your name and phone number, and one of our case members will get right back to you to assist with those unemployment applications.
Yeah, and the next question was related to immigration services and how and who is okay. Good.
We're early in this one. It's fine.
Who to talk to? Okay, so. 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 Okay, so The next question was related to the immigration services and who to talk to during this pandemic. And Betsy Quijano replied that LCH is continuing to work with attorneys, Lindsay Sweet and Audrey Allen, and they are providing consultations over the phone twice a month. You just need to call a caseworker and they will hear about your case, write it down, place a note, and if it's needed, they will schedule you with the attorney and give you a legal consultation with them. On June 8th, social assistants also started seeing members in person with an appointment at LCH. So now you can call, get your appointment, and just remember, it's not a walk-in. You just have to make an appointment to see a caseworker.
So then we received some encouraging words from one of our members who lives in another country, but because of the pandemic, she has been stranded here in the United States. So LCH has been able to assist her with getting medications and appointments while she's here in the United States.
Awesome. And then another question was raised. This one was regarding insurance, not insurance, but assistance on how to pay rent and food. Betsy Quijano replied that we can call LCH as well as to get help connecting with organizations. There are different organizations that we can connect you to get help. There is help available, but for these cases, it is based on where you live. So each town, better said, each town has its own resources, its own organizations that we have connections to those. And you just need to give us a call. We'll be more than glad to connect you to any of those. And with our social assistance department has the list of these helping organizations in the area. Also, Dr. Israelson added that other organizations have contacted LCH to be the point of contact for them so you can also place a call to LCH if you are in search of other resources as well, not just housing and food. So yeah, call the social assistance department.
And then finally, we ended our Congreso with some thoughts from our panelists. So Dr. Seppa provided tips on how to avoid contracting COVID-19 and how to stay safe. So definitely make sure that you are disinfecting your devices or objects that you use a lot to help avoid transmission. Make sure that you're washing your hands often. And when you have to cough or sneeze, cover your mouth with the inside of your elbow instead of your hand. If you believe that you have any COVID-19 symptoms, please stay home. And that will help to avoid getting other people sick, and just give LCH a call so that we can see you, assess your symptoms, and make sure you're doing okay.
Yeah. Abner Santiago shared about personal care and it's important throughout the daily routine, even more during this pandemic season. So we can suffer extra stress, and he wanted to just share that 2 tips for personal care. One will be to set a specific time to go outside, when you can just take a quick walk or even eat outside. Just sit with your family, place a table and eat outside, and that will help you just kind of relieve some of that stress. Find activities that are like a quick walk around the block. That will also help. And then the second tip will be to remember laughter. Laughter is important and is a way to release the tension in our body and improve our overall health. Watch a comedy show, a talk with a friend that will make you laugh. So those are some of the tips that Abner shared with us.
And then Betsy let us know that on June 8th, social assistants started to see people in person in Kennett and West Grove. But again, those sessions are only via appointment. So we'll continue to help over the phone. So if you want to apply for unemployment, just make sure that you have information about your employer, like who it is, how many days you've worked, where you worked, and their phone number. That helps because it'll help to eliminate any delays in you getting your application processed. So before you come in or before you give us a call, just try and make sure that we have that information so that everything goes through smoothly for you.
Yeah, and then Dr. Israelson ended up with the explanation of the transition from red to yellow phase, and that during the yellow phase, some employees can go back to work, but people who can work from home, they are still encouraged to stay and working from home. There are also some businesses opening, but they are asking for from offices to use 50% capacity and medical facilities to increase face-to-face appointments, but masks are still highly recommended. LCH will start having 2 social assistant staff in the office and more behavioral health consultants in-house as well.
Yeah, and then she also just wrapped up by saying that she's very proud of the LCH team and our members, and just how impressive it is that everyone is following instructions to help prevent spreading COVID-19, and particularly with the staff, how hard they're working. So LCH has continued to provide services, and everyone's really just bringing their best energy to their jobs to make sure that our community stays well and healthy. So she asked the community, if possible, to send letters of appreciation to let the staff know about the great work that they're doing and that it's appreciated in the community. So if that's something that you're inclined to do, you can feel free to send them to LCH. So these were the highlights from our first ever virtual Congreso. So remember to follow us on Facebook and Instagram, or subscribe to our YouTube channel. It has a ton of information regarding our services, regarding how to stay safe during this time. And you can also visit our website, lacomunidadhispana.org, for updates about LCH. So thank you so much for tuning in, and we hope you have a great day.